And we will move on in the program to our next speaker, who is Pam Taub from San Diego. And she will tell us about lifestyle strategies for cardiometabolic diseases. Pam, are you there?
Yes, can you hear me?
Hear you.
Can you hear me okay?
We can hear you, Pam.
Okay, great. Well, greetings from San Diego, and I will start to share my screen in just a second. Sorry, I'm just trying to navigate this. Okay, great. I think you can see my slideshow, correct? So I'm Pam Taub. I'm a cardiologist and a translational researcher at UC San Diego. My lab focuses on lifestyle and pharmacologic strategies for cardiometabolic disease. I'm going to start with a question for the audience that I hope will have you thinking about different strategies for improving cardiometabolic health. The first patient that I want to talk to you about is a 53-year-old male who has metabolic syndrome, currently not taking any medications, but he wants to decrease his weight. And he understands that metabolic syndrome is associated with increased risk for diabetes. And he wants to start with lifestyle. So what is the lifestyle strategy that you would recommend? Would it be caloric restriction? Would it be intermittent fasting? Would it be a vegan diet or a ketogenic diet? So this is the patient, and this is an intervention that I did on this patient. And what I have depicted for you is his baseline values and then his values in 3 months. And what you see here is the blood pressure improves. So the systolic goes from 144 to 126. The weight decreases. It goes from about 223 to 192. The percent body fat decreases. The waist circumference decreases. Glucose improves. The hemoglobin A1C improves, and lipid parameters improve, as well as the fasting insulin. This is the change that you see in his body composition on DEXA scanning. And what you'll notice is around the abdominal area that there is definitely a decrease in the girth of his abdomen. And that translates to what we see in the decrease in percent body fat. Here is his MRI. When we started, he had a significant amount of fat in his liver, and that was measured by a pretty novel technique called MRI proton density fat fraction. And it's a really great non-invasive way of measuring liver fat. And we have typically done liver biopsies to make the diagnosis of non-alcoholic fatty liver disease, which is associated with metabolic syndrome. But this is a great technology to non-invasively quantify liver fat. And what you see is after 3 months, this patient had a significant decrease in his liver fat. So the question now is, what caused the change in the patient's body composition, the improvement in the cardiometabolic biomarkers, and a decrease in liver fat? Did I start him on metformin? Did I ask him to do time-restricted eating, where you eat for 10 hours and you fast for 14 hours? Did he do a ketogenic diet? Did he do a bariatric surgery? Did he engage in caloric restriction, increase his exercise, and also have a vegan diet? So all of these are potential possibilities, but what we actually did in this patient is B, which is time-restricted eating, where we had him eat for 10 hours and fast for 14 hours. So now I want to talk about lifestyle in general. And unfortunately, this is an area that doesn't have a lot of evidence-based research. And so there is a lot of garbage out there about things that patients should do. And many times I see patients getting into trouble with doing things that they read on the internet. So I remember having a patient who read that he should fast for 2 days and engaged in not eating anything for 2 days, was on an antihypertensive, had a syncopal episode, hurt his head, had to come to the emergency room, and had a subdural hematoma. So sometimes we don't really realize that some of these interventions that are often advertised on the internet or in popular media don't have data behind it. And many of these interventions we have to be very cautious about in starting in patients, especially on medications. But this is a field that is evolving, and there are some great studies that you've heard about being done by many of the researchers at this conference, both at basic science and at a translational and clinical level, looking at some of these strategies, so that I have a lot of hope that this area is going to be a very promising area of research, and it's going to translate into evidence-based therapies. When I talk about lifestyle with my patients, there's a lot of components to it. It's what, when, and how much we eat, sleep, and move on a daily basis. And so it's not just what you eat, it's also when you eat. And I'm going to make a very important argument for the importance of when you eat. And one thing that we know is that lifestyle interventions do work. When patients engage in lifestyle interventions, including decreasing alcohol intake, sodium intake, for instance, we know that there is a decrease in systolic and diastolic blood pressure. And a lot of times, these lifestyle interventions are equal to pharmacologic strategies. So in many patients who really don't want to take statin therapy, who have metabolic syndrome, we start with lifestyle interventions. And if they do the intervention correctly, they can get significant decreases in their cholesterol levels and can defer starting statin therapy. So we have to remember that lifestyle interventions work, and they often work synergistically with pharmacologic therapy. So I take care of some very sick patients who've had multiple heart attacks, have had bypass surgery, and they often have very high levels of LDL cholesterol. So in these patients, I do use pharmacologic therapy, often statins and a newer category of drugs called PCSK9 inhibitors to lower their cholesterol. But in addition to these drugs, I will deploy lifestyle strategies. And when patients take the drugs and use some of these lifestyle strategies, there is really a significant decrease in all of these adverse parameters. Now I'm going to shift focus and talk a little bit about circadian biology. And this is something that my close collaborator, Dr. Sachin Panda at the Salk Institute, has really educated me on over the years. And that is how important our circadian rhythm is to our body function. So for instance, here, what we see is in the evening is when muscle performance peaks. So many times I advise patients to exercise in the evening. We have peak insulin sensitivity earlier in the day, and I advise patients based on this to consume their calories earlier in the day rather than at night. So circadian biology has really emerged as an important understanding that we are now deploying into clinical care. What's really interesting is how we have evolved. Our ancestors were very restricted in when they could eat and when they had to sleep. They were really governed by the sun. So when the sun set, they had to sleep. In modern society, we have a lot of freedoms, and we can eat basically whenever we want. We tend to sleep much less, and we also don't concentrate our physical activity during the day. We have the opportunity to do physical activity throughout our day, but most people don't utilize that, and most people capitalize on the opportunity to eat, and often people are eating 3 meals a day, snacking often, after dinner having a bedtime snack. So basically consuming food until they are asleep. And this is really not the way our bodies were meant to function. And what we know is the circadian clock is really important to overall metabolism. And when patients are not conforming to the demands of the circadian clock and eating whenever they want, there's a lot of problems that occur. And we know this especially from some of the work that we've done in shift workers who are forced to work at night and often sleep during the day. And we see, especially in this group, that they're more susceptible to cardiovascular disease. And some of the things that occur in patients who really are eating more than 10 hours a day and not being active is they have an increased risk of insulin resistance, fatty liver, high blood pressure, etc. So one of the things that my research is focused on in collaboration with Dr. Panda is how to really incorporate circadian biology into the care of patients with cardiovascular disease. What's also really interesting is circadian biology doesn't just apply to cardiometabolic disease, but there's a lot of other disorders that it applies to, including gut function and the microbiome. Circadian biology is important for inflammation. And when patients engage in time-restricted eating and other strategies that capitalize on circadian biology, there is a decrease in inflammation. I just showed you an example of a patient who had fatty liver that improved when the patient engaged in a fasting strategy. It also improves sleep. So it's really important for a wide variety of body functioning. I'm very interested in the cardiometabolic syndrome. And my research is focused on metabolic syndrome, which I really think is a critical point for intervention. And it's the tipping point to diabetes and cardiovascular disease. And so if you can modify disease at this stage, you can really prevent adverse cardiovascular outcomes. And to meet the definition of metabolic syndrome, you have to meet 3 or more of the criteria that I have delineated on this slide. And unfortunately, over 1/3 of the US population meets this criteria for metabolic syndrome. And the first line of treatment is diet and lifestyle interventions. And as I mentioned earlier, the reason this is so important to treat, because that metabolic syndrome leads to type 2 diabetes, which is very prevalent in the United States. The American Heart Association recognized the importance of meal timing and frequency and really has called for action for us to have more of a focus on meal timing and frequency. And they recognize the importance of circadian biology. And so we need to be coming up with more lifestyle interventions that focus on meal timing and frequency. So one of the strategies that we have used in our lab is time-restricted eating. And time-restricted eating is a strategy in which you ask patients to eat for a certain period of time. There's been different times that have been tested. Sometimes patients are restricted to as short of a period as 8 hours. In our studies, we have used 10 hours because we find that leads to long-term adherence, and it's very doable with people's work schedules. And it's also based on a lot of work that Dr. Panda has done with animal models, where 10 hours seems to be the sweet spot where you get a lot of the cardiometabolic benefits. And a lot of people are confused about what time-restricted eating is. I told you about a patient of mine who read about it and fasted for 2 days and passed out. And so there's lots of different strategies, and they're all called intermittent fasting, but they're not all created equal. So for instance, the strategy where you have to fast for 2 days a week, I would not have 99% of my patients do this strategy. It's just not safe with the medications that they're on. What I have patients do is time-restricted eating, where I really try to get them to eat over a 10-hour window and fast for a 14-hour window. In our clinical studies, we have found that this is safe. And as I mentioned earlier, the adherence to this type of time-restricted eating seems to be better. We have tried the 8-hour strategy, and many of my patients just find it very difficult to adhere long-term to an 8-hour window where they can only eat for 8 hours. So do remember that there's a lot of different types of fasting, and when someone says that they're fasting, you really want to probe deeper and figure out exactly what the strategy is. And time-restricted eating isn't just something that you do once or twice a month. It's what you do every day. And in our studies, we have people do this strategy every day. We have seen in animal models, if they do it 5 to 6 out of 7 days, there is still some benefit. So this was the study that we recently conducted in patients with metabolic syndrome, where we asked them to engage in the strategy of time-restricted eating. And we also monitored them with continuous glucose monitoring. We did a baseline measurement of their blood glucose before they started time-restricted eating and then after. And here's an example of a patient who was in our study. And I find that continuous glucose monitoring just provides so many insights into metabolism. And so this was a patient who, when they ate well, for instance, when they ate pistachios and peanuts, you see that their blood glucose was in a good range. However, when they engaged in a meal of burgers, fries, and a milkshake, you can see that there's a spike in the glucose. Not only is there a spike, but it's also the duration of the spike. So there's a prolonged duration where the glucose is elevated. So you get a lot of insight into different foods that increase glucose levels, and it's very different for different people. And of course, physical activity and genetics play a big role as well. So this was our study that was recently published. And what we saw is when we asked patients with metabolic syndrome to engage in time-restricted eating, there was a decrease in body weight, waist circumference, blood pressure, lipid parameters, and also they had a more restful sleep. And this is just a deeper dive into the data, looking at changes in LDL cholesterol. As a cardiologist, LDL cholesterol is a very, very important parameter that I track because it's really associated with increased incidence of cardiovascular disease. And this is the parameter that we try to lower with so many different pharmacologic strategies, including statins. And it's nice to see that a lifestyle strategy can have an impact on LDL cholesterol. What we also saw was a change in blood pressure, waist circumference, and fasting glucose in the patients that were in the study. And also the weight and percent body fat decreased. I was also very happy to see that there was a change in visceral fat. So visceral fat is the fat that's often hidden. So you can be very skinny and have high amounts of visceral fat. And this is the fat that often increases the inflammatory substrate. And so reducing the visceral fat also is going to decrease inflammation. So we saw in our study improvements in a lot of cardiometabolic parameters, and this study demonstrated that time-restricted eating is safe and a potential intervention for patients with metabolic syndrome. Here I'm just briefly highlighting some of the findings that we saw on continuous glucose monitoring in these patients. And we saw some really dramatic changes in estimated A1C by CGM. This is an example of one patient where the A1C went from 6.7 to 5.1. Here's another patient where the A1C and the average glucose decreased. So when we talk about fasting, some of the mechanisms are really important to understand. And this is a beautiful paper from Rafa de Cabo and his group from the NIH in the New England Journal, just depicting some of the mechanisms that are acting when patients engage in time-restricted eating. So the main source of fuel when we're not fasting is glucose and fatty acids. And when we go into a fasting state, we convert our predominant substrate for metabolism from glucose to fatty acids. And that leads to generation of ketone bodies, which provide a major source of fuel for many tissues, including the myocardium. And they regulate the expression and activity of many proteins and molecules that influence health and aging. What's really interesting to me as a cardiologist is there is a class of drugs called SGLT2 inhibitors, which I use a lot for my patients with type 2 diabetes. And these drugs are associated with improved cardiovascular outcomes, including a reduction in cardiovascular death. And one of the potential mechanisms of SGLT2 inhibitors is thought to be the shift from glucose to fatty acids, leading to the generation of ketone bodies such as beta hydroxybutyrate, which is a real efficient energy source for the myocardium. What we've seen is that repeated exposure to fasting results in a lasting adaptive response that confers resistance to subsequent challenges in the body. So fasting is a way to condition your body to be more resilient to cardiometabolic stress. And fasting helps you have more metabolic efficiency. And this figure is just depicting the change that occurs when we go from a fed to a fasting state. Finally, I just want to conclude and make a plug for overall lifestyle management. I am the director of our cardiac rehab program at UC San Diego, and this is a program for patients after they've had a heart attack, after they've had cardiac surgery or a heart transplant. And what we see in these patients that are pretty sick is that lifestyle intervention does work. And I love to show this to patients because patients don't think that just engaging in a lifestyle strategy can actually make a difference anatomically. And here's a real patient, and you see a coronary angiogram before and after. And the only intervention that was done here is the patient engaged in an intensive cardiac rehabilitation program. And what you see is the coronary artery diameter is improved after lifestyle. So lifestyle is really important. In the interest of time, I won't play this entire video, but this is a paradigm that I like to talk to my patients about, and that's the cardiometabolic jackpot. And so there's a lot of aspects to this. It's what you eat. Do you eat a Mediterranean diet? Do you eat a keto diet? Do you eat a vegan diet? What's the number of calories you eat? How do you consume the calories? Do you fast for 14 hours, or do you do alternate day fasting? How do you eat your meals? Do you eat small, frequent meals? Do you eat 3 large meals? And of course, there's the wild card that encompasses genetics, exercise, level of stress, microbiome, et cetera. And so what we want to do is we want to personalize these different parameters for each of our patients so that we can help our patients hit the jackpot in terms of their health and not have cardiovascular disease. With that, thank you for the opportunity to present at this conference, and I'm happy to take any questions.
Very, very nice presentation. We're running quite late, so we will not have any time for any questions now, unfortunately, but I highly encourage you to go to Slack, and then you can answer questions on the channel. Thank you very much.